Welcome to the AAC RERC webcast series. My name is Sarah Blackstone, and I'm going to be your host. Also joining me today will be 5 experts from around the country who represent various disciplines. We're going to be talking about supporting effective patient-provider communication across healthcare settings. The AAC partners and staff recognize the key role that communication plays in healthcare. Currently, the problems experienced by both patients and healthcare providers with communication are complex, multifaceted, and pervasive. As such, these problems beg for creative, collaborative, and 21st century solutions. For the past 2 years, the AAC RERC has helped maintain the patient-provider website, a portal of information with articles, presentations, research reports, annotated bibliographies, and examples of materials and technologies. We also host an international forum which meets monthly and works collaboratively on projects, for example, like this webcast. These are the experts who you'll be meeting today. You'll notice that they come from around the country and are joining us virtually, as we're a virtual center. The goals for the webcast are stated on this slide. We are hoping to increase your understanding of why communication is so important in healthcare settings, as well as raise your awareness about some of the federal laws, policies, regulations, standards, and technologies that are available. Given who we are, we're going to highlight ways in which AAC and assistive technologies can contribute to the creative and collaborative 21st century solutions to those problems that we're facing today. Finally, you're going to hear about people who have faced real critical issues in healthcare settings and the kinds of solutions that our experts are helping to forge and bring about. Let me remind you that we all are patients at one time or another, as well as providers, many of us. Thus, we all face patient-provider communication challenges. So what do we mean by effective patient-provider communication? This is the definition that the Joint Commission has published. What I'd like to point out is that communication, to be successful, requires the joint establishment of meaning. Communication vulnerable populations in healthcare settings is not a little problem. There are millions of people who are at risk. We can typically think about them in 4 groups: people who have limited health literacy, limited English proficiency, individuals who have speech, language, hearing, or cognitive disabilities that interfere with their ability to communicate, and also people who have different cultural, religious, or sexual orientations that often can affect communication success. So given the diversity in our country, individuals often belong to more than one of these groups. Thus, it's important to note that there's overlapping issues related to these circles. This points out the need to collaborate, which you'll be hearing a lot more about today. Different disciplines have different sets of expertise. This slide is kind of busy, for which I apologize. The point is to just begin to give you a sense of the kinds of solution ideas that relate to augmentative and alternative communication, assistive technology, and strategies that include mainstream technologies increasingly today. So, for example, people who have severe speech or language problems may use speech-generating devices. Hearing difficulties may require hearing aids, may have had a cochlear implant. Individuals with limited English proficiency may need access to materials and interpreters that help them negotiate in the healthcare system. People with limited health literacy may need access to forms with plain language, graphics, etc. The next two slides just give you an idea about some of the communication tools and technologies that are available today. As you can see, there are low-tech, high-tech, middle-tech, and some mainstream technologies with apps. Some companies are even beginning to package these so that they can be readily available in nursing stations and deployed by nurses and speech-language pathologists and other professionals when they're needed, just in time. Finally, we need to remember that to meet the varied needs of patients and providers, trained professionals must get involved and work together collaboratively. Now, we're going to meet our first speaker, and she's going to tell us about the research base that underlies the movement in patient-provider communication and defines the needs and the impact when communication is successful.